Bismillahirrahmanirrahim. The clearance of hormone from the blood is discussed in this video. The concentration of the hormone in the blood is determined by rate of the removal of the hormone and rate of the secretion of the hormone. The rate of the removal of the hormone is termed as metabolic clearance rate, and it is defined as number of milliliters of the plasma that is cleared of the hormone per minute, and it is determined by ratio of rate of disappearance of the hormone of plasma and concentration of the hormone. The unit that is used for this is nanogram per minute for the rate of disappearance and nanogram per ml of the plasma for concentration of the hormone. So how do we determine this? To determine or to measure this hormone clearance rate, purified hormone solution is bind with radioactive substance and it is infused at a constant rate, and then a steady radioactive concentration is achieved. When the rate of disappearance is equal to a rate of diffusion, it means that uh, there is a steady radioactive concentration. So the plasma concentration measurement of the radioactive substance is then taken, and the unit is for nanogram per ml of the plasma. The clearance of the hormone from the blood is by various mechanisms such as metabolic destruction by the tissue, hormone binds with the tissue, hormone excreted by the liver into the bile, and hormone excretion by the kidney into the urine. So the major pathway of clearance of the hormone are metabolic destruction, inactivation in the liver, kidney or target tissue via enzyme, binding with the tissue, hormone is absorbed or degraded within the tissue, it is excreted via bile such as steroid hormone, thyroid hormone that are conjugated and excreted, or there is renal excretion of the hormone. So water soluble hormones are filtered and excreted rapidly. Hormonal concentration may be increased in the body, especially when the clearance is decreased. Whenever the clearance is decreased, there will be increased concentration in the body, as happens in the with the steroid hormones in the liver damage. So hormone, whenever acts on the target tissue, it acts via receptor, and this hormone is taken through the endocytosis into the cell and it makes a hormone receptor complex. This hormone receptor complex is either this hormone receptor complex in this the hormone is metabolized and receptor is then recycled for reuse. Most of the peptide hormones and catecholamines, they circulate freely within the blood because they are water soluble, and uh, they are degraded by the enzymic action, and they are degraded by the enzyme action and then excreted by the liver or by the kidney, and so therefore they remain within the circulation for a short time, such as the angiotensin 2 half-life is less than 1 minute, while the hormones that are bound with plasma protein, they degrade slowly, and thus they remain in the blood for a long time, and uh, they remain for days or even weeks in the bloodstream. So the half-life of the steroid is about 20 to 100 minutes, while the half-life for the thyroid hormone is 1 to 6 days. So this table is summarizing this concept here. The peptides and catecholamines are water soluble and they are free in the plasma, and the half-life is minute or less, and they cleared away rapidly via kidney or liver, while steroids are lipid soluble and they are bound to plasma protein. Their half-life is 20 to 100 minutes, and they require metabolism, so their clearance is slow. The thyroid hormones such as T3 and T4 are also lipid soluble and they are bound with the proteins. More than 99% of these hormone is bound with the protein, and their half-life is 1 to 6 days, and their clearance is also very slow. So the hormone binds with the receptor, the complex internalized through endocytosis, hormone is degraded and the receptor is recycled to the membrane. This is common in peptide hormone and growth factor receptors. But in certain conditions, there is problem, such as in the liver disease. In the liver disease there is decreased hepatic metabolism, so there is decreased clearance of the steroid hormone, and the hormone accumulate within the body. For example, estrogen accumulates and results in gynecomastia. If there is dysfunction in the kidney, there will be decreased excretion of the peptide hormone and increased level of the insulin, parathyroid hormone, and or atrial natriuretic peptide. Thyroid disorders alter thyroxine binding globulins that alter free T4 concentration, and this may affect hormonal efficacy and lab interpretation. The drug interference is another clinical implication in the hormone clearance. Estrogen glucocorticoids can affect MCR, and they alter the hormone pharmacokinetics. Thank you for watching this video. If you have any query, please write in the comment box.